rush to supply hospitals with the equipment they need to protect themselves and save lives as this coronavirus continues to spread. Thanks for joining us tonight at 6. I'm Scott Swan. Anne Marie is joining us from her home this evening as we do our part to get more people staying at home, too. First, though, we want to get to Rich Van Wyk, who joins us from the State House with how the state is planning to help parents in the medical field. Rich?
Well, first of all, Scott, we're seeing significant additional help for healthcare workers to make sure they have the protective equipment they need to stay safe. The Indiana National Guard, we are told, is busy once again sorting and shipping semi-truckloads of protective masks, gowns, gloves, hoods, all to hospitals and healthcare facilities. This is Indiana's second shipment from the National Strategic Stockpile. At the same time, the governor and the Department of Education is taking on the child care dilemma facing many parents. They are encouraging schools, and you put parentheses around encouraging schools, to reopen and look after the children of emergency workers. At last count, only about half the school districts were providing any child care.
Our charge under the governor is to expand that and making sure that we are taking care of those who need child care so they can operate for the essential needs of the state of Indiana. We are also well aware we need to target our priorities to health care, hospital providers, and public safety employees.
COVID-19 has put Indiana's economy in reverse. The state is already calculating the costs of rising unemployment, the loss of income tax, retail taxes. Governor Eric Holcomb likes it to going to war. Fortunately, Indiana's war chest has a budget surplus of more than $2 billion.
We haven't spent that yet, but that day's coming. And Hoosiers should know that this is the exact reason why we were so fiscally prudent year after year after year after year. It wasn't when I said we were going to war with it.
In addition to that prudence, the state is counting on federal help from Washington to recover to the tune of about $1 billion or more. Scott?
All right, Rich, thank you. And the Marion County coroner tonight is pleading for people to stay home as their office monitors testing. Our Steve Jefferson has the coroner's plea about doing your part to stop COVID-19.
The Marion County Coroner's Office is working to stop the spread of COVID-19. Eyewitness News has learned that they did uncover at least one case where a person who died of either natural causes or unknown causes did test positive for the coronavirus. Now, the coroner is also urging people to take heed to the governor's orders and follow the recommendations by state health officials, saying that's the only way to stop the spread of COVID-19.
You can't look at someone and tell whether they have coronavirus. So the best thing is to really heed the advice that has been put out, which is, 1, stay at home.
The coroner's office is waiting on several other test results as they work to stay safe themselves from the coronavirus.
Indiana hospitals say they are prepared as they can be for the coming surge of coronavirus cases, but they say they do need more equipment. The Indiana Hospital Association says ICUs will need more ventilators if the worst case scenarios proves to be true. Also, IU Health says it still needs more personal protective equipment. Hospitals did receive that very first shipment of supplies from the state. Those arrived last week. The White House now says production is speeding up. And with so many healthcare facilities now running low on medical supplies, there's a 7th grader who is now making it her personal mission to do her part and help. Our Sarah Jones now tells us the personal reason why this 12-year-old decided to start making safety masks.
Every superhero wears a cape. For health workers, part of their armor includes a mask. Caden's mom is one of those heroes. So when this 12-year-old learned of shortages in other states, she knew she had to get working before the shortages reached here.
I'm making masks for people in nursing. I like helping people, and I thought it would be a cool idea.
She started 3 weeks ago and is already filling a demand right here in central Indiana.
We made a few dozen, and our church has made about 100 for us, so they're donating them. So I start 2/3 of the way down.
She showed me how she sews the masks over Skype. But 3 weeks ago, she didn't know how to use her mom's sewing machine.
She taught me, and then I taught her how to make these masks, which was kind of weird. This was our first prototype. It was a very simple design.
But with a little help
In this video, we're going to show you how to make a mask
from Deaconess Hospital.
I found a YouTube video. It has a lot more stability and it's more filtration. It doesn't fray like this one would because the hems are inside the mask.
This 7th grader says making masks is something she thinks a lot of kids could do while they're e-learning at home.
And we're told that she's planning on donating those masks to local healthcare facilities. Scott?
Well, we continue to do our best.